Welcome to this new edition of Medical Discoveries. Today we are talking about platelet-rich plasma, which is commonly known as PRP, and stem cell treatments. Now we are talking about adult stem cells, not embryonic, but adult stem cells, as they are being used to heal your back pain or joint pain or sports injuries. We have been using these treatments for spine conditions of conditions like arthritis and sports injuries affecting your knee, your shoulder, your hip, or any other joint. These treatments have been in news lately because a lot of these celebrities and professional players from NFL and NBA and PGA Tour golfers have been using this very successfully and safely. So let's talk about these, and hopefully this program will help you understand these treatments, and maybe you will consider these before you go for any type of orthopedic surgery. Now today we have Charles with us. We did one stem cell treatment on him, and he's here to share his experiences. We basically, if I remember correctly, for back pain, right? We did.
That's correct. I've had low chronic back pain for a number of years now.
And we did. We took the stem cell from your back, hip bone, in the back, and a little bit of fat.
That's correct.
And mixed it with some PRP from the blood, and then injected under this special ultrasound. So how was the procedure overall? What would you say?
It went very well. It was painless. I was given pain medication before and during the procedure, so I didn't feel any pain at all during the procedure or after the procedure. The recovery period was short. I was back to work the next day, and within a couple of weeks began experiencing relief in the lower back pain right away, and it's made a tremendous difference in just my lifestyle and being able to live with the pain, because it's diminished now because of the procedure.
Wonderful. And your lifestyle is much better now, able to do things that you want to do.
Absolutely.
Good. See, that's the amazing part. This procedure is not done in the hospital. We do it in the office right here. You know, people come in, takes about hour and a half, maybe 2 hours based on what we do, and we do it in the office, and they go back. We don't use any anesthesia. It's only local numbing medicines and some oral pills that we give people to calm down. So they don't start beating up my medical assistant or something.
That's definitely a good thing.
So we and then there is absolutely no anesthesia. There is no general anesthesia. I mean, there's a local numbing medicine, like I said, and there are no laughing gas or anything. There's nothing we use that's gonna be harmful or cause any side effects. The other thing I want to mention, like we did in your case, we're doing all this stuff right in front of you.
Right.
You know, is everything that we are doing is doing it right in front of you. We took out the cells, some bone marrow from your hip bone, and we put in a spin, and then we did a little bit of fat, 1 or 2 teaspoons, and we put that in a small spin and together, mix it together, and we took the blood and then take out the platelets and those things, right? And we did all this stuff in front of you.
Absolutely. I was awake the whole time. I knew exactly what was going on, and it didn't take very long either.
And because we are not sending this outside somewhere, we're not mailing it out to Israel or some other place outside like some other people do, or mixing anything. We didn't mix anything in there. We were just right your tissue. We took it from your body and injected back into your body. We didn't put, some people put growth hormone or steroids or anything. We don't do any of that stuff. We don't store it. We don't freeze it, we don't send it out, and it's done at the same procedure, same setting. And that's the key thing, is because you're doing all these things, the chances of infection or rejection are almost nil, almost zero, you know. And Beth was talking earlier with Charles, and you said about the needle or something you were worried about.
Yeah, like me, like a lot of other people are worried about the needles.
Right.
So were you worried anything about, you know, how painful it would be?
Well, I worried about it, but absolutely didn't feel anything at all. The procedure was totally pain-free. You can't feel the needles or anything that's going on. You feel a little bit of pressure, but that's it. And as I said before, I was awake the whole time, so you have a good appreciation of what's going on, but there's absolutely no pain at all.
That's good. You know, that's, and a lot of people do. There are lot of patients. They're worried about the needles, of course.
Yes.
I was surprised that you're worried about the needles, but as a medical assistant, I mean, you know, because you're injecting people all the time, giving them injections all the time. But yes, I understand. Cost is another issue, and people talk about the cost. And really, to be honest with you, it's like fraction of a cost of a surgical procedure. Orthopedic surgery, you know, you work in a hospital setting, and you know, people have to have surgery in a hospital. The doctor cost, anesthesia cost, hospital cost, physical therapy cost, losing money because you're not going to work.
Right.
You know, that's a cost. All that can land up about $40,000-$50,000 overall, and these procedures are a fraction of that, and are, I think, in most patients, in my opinion, are more effective. I mean, I've done, you know, I don't know, my son would like to mention that or not, but he's 19-year-old, and he was having a shoulder problem, you know, lifting weights and everything, playing basketball, and I did PRP on him, you know. And honestly, within a week, no more than a week, he would start feeling better. He was not having pain when he was sleeping on this side. He was able to play basketball more. He was able to lift weights and everything. I mean, that's the reason why all these professional players who can go anywhere and spend as much money as possible are getting these treatments done.
Oh, absolutely.
You know, because it's not just about money, you know. So anything else you would like to share for patients who are thinking about orthopedic surgery and should consider this instead?
Just that, you know, this procedure for people like myself that have long-term chronic pain, this is very good news, because it allows you to have a curative treatment that works without having to undergo invasive surgery.
Yes.
Or any of the time that's involved with that, or the expenses involved as well,
Right.
or the pain for that matter. So overall, it's a much better option.
Yep. Thank you for watching Medical Discoveries. Remember to tune in for our next program. In the meanwhile, you can visit us on Facebook or our website, or even call us if you have any questions. The number and the website address is listed on the screen. We will provide you more information in our next shows about the PRP and stem cell, as they are being used as excellent alternatives for orthopedic surgery for your any conditions of back pain, spine, joint problems, any sports injuries. Hope you enjoyed this show, and we look forward to meeting you on our next show.